Hello, I'm Dr. Pete, and the subject of today's talk is just general gynae anatomy. We'll start with just a basic diagram of the uterus, and I'll just go through this in a tick. This part here is the cervix, up to about here. That's about 2 or 3 centimeters along. That's the cervical canal there, and here we have the endometrial cavity. And inside this part here, this is called the myometrium. And there's a little lining in here which changes due to various hormonal influences, and that there is the endometrium. And on the outside here, we have a little thin layer of peritoneum, which is, of course, the peritoneum. Obviously, that's the visceral peritoneum. Okay, now, what we have attached to the uterus here is a fallopian tube on each side. In reality, they don't look like this at all. They're just floppy. They have no muscles or structure or anything. It's just simply a tube which has got no muscles or anything in it. And on the end of the tube here, this part here is called the fimbriae. And that's like little fingers which will go and wrap itself around the ovary, or wherever the ovary is ovulating. It just magically finds the ovulating follicle and collects the egg. This part here is called the infundibulum. And this part here, sort of from about here to there, is called the ampulla. And this here is the isthmus. These are all got reasons for this. And the little bit of tube that goes into the muscle of the uterus has got several names. It could be either the interstitial or the cornuole. The cornue, sorry, C-O-R-N-U, cornue. And there's a cornuole part. I'll write that again. I've got good doctor's handwriting. Let's try that again. C-O-R-N-U-A-L. That section right there. Now, the reason for this is different anatomies or different terms is when the egg is released, it's collected by the fimbria, and fertilization happens in this area here, in this infundibular area. It waits there for a few days, and then when it's finished being fertilized, it then on day 4 moves along through the ampulla and into the isthmus and into the interstitial part, into the endometrial cavity. And at various places you can get ectopics. The most common place to get ectopics is here in the infundibular or the ampulla area. It's really bad to get an ectopic in the corneal area because an ectopic pregnancy there is difficult to remove. You have to cut a piece of the uterus out, and it's very challenging and often associated with bleeding. Now, in this location here is the ovary, and there's just like a thickening of peritoneum there, and that's called the ovarian suspensory ligament. I'll just write that down here for you. Ovarian suspensory ligament. Now, in this here is the vagina, and there are these little pockets right here on there. That's the left and the right side, and they're called it's called a fornix. So that would be the left fornix on that one there. Okay, so now I'm just going to redraw this again, but with a bigger picture attached to the rest of the body. So now if we draw the uterus now a little bit smaller down here. There's our fallopian tube. And here's our ovary. Again, we always draw it like this on pictures, but in reality, they're all just floppy. The ovaries and the fallopian tubes are all floppy. So there's no actual structure holding them there. These little, just keep the circulation, keep the this thing suspended, but it can move around, the ovary can. Now, just grabbing a different marker. If we were to draw major blood vessels coming down here, this is the aorta, and it bifurcates here into the common iliac arteries, and then this bifurcates again into the external and internal iliac arteries, and then the internal iliac artery will then split into the anterior and posterior branches, and then the anterior branch comes around like this, and the uterine artery is a branch of the anterior iliac artery. And the interesting thing about the uterine artery is once it gets into the uterus, it's shaped like a little corkscrew as it goes up the side of the uterus. And the reason why it's shaped like that, to allow for expansion during pregnancy. So those little vessels stretch right up. And often when you do a hysterectomy, you can see these little curly vessels on the side of the uterus. Now, the ovary gets its blood supply from a different area. So if we imagine here is the, here we have the renal arteries. This is of course not to scale. So that's going to be a kidney up there. So there's a little kidney, another little kidney. Then the ovary gets it directly from a branch of the aorta called the gonadal artery, or the ovarian artery in this case. And that goes around the pelvic side wall, separate, and crosses over and goes straight into the ovary. And just for clarity, just clear that up for a minute. It's obviously a three-dimensional subject, but so the ovarian artery is in this, and there's obviously a vein that follows this back, of course, and there's this thickening on the side wall of the peritoneum, of the sort of pelvic side wall peritoneum, and that thickening has all these vessels in it, and that we call the IP ligament, because we like to give things a complicated name. That's called the infundibulopelvic ligament, and it's the IP ligament, which is this right here. And so if you have to take out the ovary during surgery, you have to identify where this ligament is, and then make your dissection through that. Now, interestingly, there's a ureter which comes down here and generally enters the pelvis at the bifurcation of the internal and external iliac artery. So as that goes on top of that little bifurcation there, and travels along the pelvic side wall, and changing course, and back to our little uterine artery, which is back here. I'm just going to clear up this ovarian stuff for a minute, because it's all very, in a three-dimensional subject. So that is our branch of the anterior iliac, which goes off to the uterus. That's the uterine artery, and here is the ureter. That's my finger there. The ureter coming down the side here, and it goes very close to this uterine artery, and we have this sort of memory jogger to help remember that this is a term called bridge over water, which means the uterine artery goes over the top of the ureter. And so when you're doing your surgery in this area, you have to be very careful to look out for the ureter to avoid damaging it. Otherwise, we have to then call our urology friends to come and repair it. So that's just part one of the general gynae anatomy. There'll be a second part looking at other aspects of the anatomy.